It's time for Wave 3 Listens Live, taking your calls to hear what you have to say and hitting the streets to be live on location in your community. Now, Norton Healthcare presents Wave 3 Listens Healthy Living Live, brought to you with the support of Louisville Athletic Club.
And welcome to Healthy Living Live. It is an absolutely gorgeous day. You just heard the forecast from Brian Good, and we're enjoying that. We are outside of Norton Healthcare's immediate care center, as you can see, the immediate care center here, and it's located at Taylorsville Road in the Gene Snyder. I mentioned it's a beautiful day, and Jackie, this show, and by the way, you know this is our former anchor from Wave 3, Jackie Hayes, and now with Norton Healthcare, you are the Prevention and Health Marketing Director,
manager of
right?
Prevention and Health Marketing.
There we go.
Meaning I get to be a cheerleader for good health and try to keep people healthy. And it's been a pleasure learning all the things about things we can do to try to stay active and healthy and prevent many of the diseases that will give us trouble. Now, today we're talking specifically about men's health.
Well, that's what I was going to say. This is a good show for me because if anything happens to me, I'm in good hands because you've got quite the team here.
We do. And we're going to start off with Dr. Charles Crawford, who is with the Norton Leatherman Spine Center, because we're talking back problems right off the bat. And a lot of men and women have issues with back problems. What is the most common problem with our backs?
Sure. Well, certainly back pain is a very common symptom that people come to the doctor for, or interrupts their life. Sometimes they'll miss work or miss important activities in their life. It affects probably 8 out of 10 people, is what the statistics is commonly quoted. Most commonly, it's a very benign problem, a pulled muscle, a strained ligament, that will eventually heal itself in typically a short amount of time. But certainly there can be other serious causes, and that's sometimes where we come in to play, to rule out other serious causes of problems, and sometimes things that will respond to certain treatments like injections or surgery.
How do you know when you should go see a specialist? I mean, you've got an ache in your back and it's a couple of weeks. When do you finally say, this isn't getting any better?
Sure. I think a few weeks is a reasonable amount of time, but certainly there's some people that have such a severe pain, even immediately, that they would like to have an opinion about what's going on, and certainly if there's any neurologic problems with pain in the legs or trouble using the restroom or something like that, that could be certainly a worrisome thing that could need immediate attention. So I don't think it's a bad idea if you're concerned and worried to check in with your doctor, but certainly checking with your family doctor, your primary doctor initially could be a good place to start, and they're very aware of who needs to see a specialist.
Doctor, it seems to me that it seems to be more prevalent with men, and I don't know if that's due to men who have occupations that require physical labor, or am I wrong altogether? Is it something that's common among both men and women?
Sure. Well, I think it depends on what we're talking about. There's certain diagnoses that we recognize are more common in women, actually. Things like scoliosis and a symptom called degenerative spondylolisthesis. But there's other problems with just back pain, disc herniations, and I agree with you. A lot of that, I believe, is activity and occupation related. Men tend to be a little more maybe weekend warrior type people, and I have some friends like that. And then guys who are also out doing very difficult jobs, heavy lifting and such.
Is there anything that men and women can do to avoid back pain? Are there maybe specific exercises that you can do to strengthen our back?
Absolutely. I always like to talk to people about lifestyle changes that they have control over. I think keeping a healthy body weight is extremely important for many reasons, and one of those being the healthier spine. Additionally, not smoking is very important. There's a lot of studies that suggest that just as smoking affects other parts of our body, it can lead to accelerated spine degeneration as well.
That's something you wouldn't think about?
No, I wouldn't think about it. And I'm interested. I didn't know if you were going to play the air guitar, or I think, Jackie, you said that looked like a saxophone.
Yeah. So
I love the visual effects here, so help us out.
So commonly, where is the most common problem for back issues?
Sure. Well, a lot of people, the most common would be the lower back, and that's called the lumbar spine area. This is a model that shows the pelvis, where the legs come into the pelvis, and then the spine holds us up. The lower back area, there's 5 lumbar vertebrae. 1 through 5, and that attaches to the sacrum, which we call S1 typically. And typically, we think that most of the problems come in the lower 2 levels, the 4-5 and the 5-1 level. That would be the most common area for someone to get a disc herniation that would potentially need an injection or surgery.
And how often is surgery necessary? I mean, I guess you try everything else before you go to surgery.
It's really hard to come up with a statistic because obviously most people that don't have surgery we don't see, so we can look at population-based things. I would say that 1% or less of people, end up having spine surgery in their lifetime would be my guess, but I really don't. I don't know if there's good data on that.
But also, I would think that back surgery, spine surgery today, compared to what it was 10, 15, 20 years ago, has certainly come a long, long way.
Absolutely. I just saw a patient in my office this morning, and he had surgery back in the 80s, and he has another surgery planned, and we're talking about the differences. There's been a lot of advancements in our surgical techniques, our instrumentation that's available, anesthesia has improved, some of the monitoring that we do and the imaging that we have nowadays allows us to do a lot more advanced surgery. Some of it's less invasive than it was in the past, faster recoveries, but also the technology as far as our diagnosis and just our knowledge of what's going on, better evidence-based outcomes, things, making good decisions for people.
As a guy who's growing older, doctor, I'm curious. We talked a little bit before we went on camera here about evolving your workouts. As I grow older, are there some exercises I should stay away from, period? Or do you recommend staying just as active as you can possibly be?
That's a great question. I talk about that all the time in the office with patients and even my friends that I see out. I've certainly changed my exercise program over the years. I tell people that now I enjoy playing a lot more golf and less basketball because I'm always worried about hurting myself, and the same with lifting really heavy objects. But there's certainly guys out there. We've seen guys in the NFL and the NBA who are up in the years in some ways, and they're still very active and they do just fine. So I think it's all relative. And it's sort of one of those things I tell people that if it hurts, probably shouldn't do it unless you have some good advice that you should keep doing it.
And one thing I think a lot of people have heard, the correct way to lift things is incredibly important so that you don't put that strain on your back.
Exactly, and that typically involves using your legs more than your back to lift. You don't want to lean over and pick something up off the floor and keep your legs straight. You'd rather bend your knees and get down lower, keep the weight closer to your body, and certainly if you can have somebody help you do lifting, then that helps as well. All
right, great information. Dr. Charles Crawford with the Norton Leatherman Spine Center. We thank you for being with us. Great information.
Thank you.
All right.
Good to be here.
And we're coming to you from the Immediate Care Center. You know where we're located, Taylorsville Road. Gene Snyder, you can't miss it. Jackie Hayes and I will be right back with more expertise about men's health. Healthy Living Live. We'll be back in a couple of minutes.